Jonathan Nelson for the Washington Academy of Family Physicians with a special report on the value of family medicine and the medical home. In America, we pay significantly more for health care than any other nation in the world. Each year, that cost outpaces the rate of inflation as the country searches for a solution. Your Academy leads a chorus of organizations touting the many benefits of the medical home. But what exactly is a medical home?
The patient-centered medical home is a place where basically patients can get almost all their health care needs met or initiated.
The focus of the providers is on the continuity of care for patients, on getting to know that person as an individual, getting to be able to customize the care delivered for their needs.
We can provide acute and chronic care services, we can provide counseling, we can set up or provide hospitalization services, where we can really provide the whole gamut of patient-centered services to make your foray into the medical field a very comfortable, seamless, and efficient one.
The emergence of the medical home, I believe, is a response to the growing recognition that the care that patients in the United States receive is not the care that they deserve.
The patient-centered medical home gives patients a personal primary care physician who leads a team of individuals dedicated to providing comprehensive and continuous care. In a medical home, physicians employ systematic solutions to ensure patients receive safe, high-quality care that's coordinated across all components of the complex healthcare system. Patients enjoy enhanced access to their physician, and physicians are paid appropriately for managing their care.
I think that family physician is the person trained with the skills necessary to coordinate that type of a healthcare team in the context of a patient-centered medical home. Our training is very much whole person and whole family and whole community based, and the idea of the skills to integrate care delivered even by other specialists to the ultimate goal of the best health outcome for that patient is actually the skill and the interest that we have.
Several recent studies have shown that in areas where primary care physicians provide the majority of care, patients receive a higher quality of care at a lower cost. Increased access to family physicians results in lower rates of all-cause mortality, fewer emergency room visits, less duplication of expensive services, and more preventive care, all of which lead to more efficient usage of healthcare resources and better outcomes for patients.
When a patient is getting good, integrated, coordinated care in a medical home, their quality of care goes up and overall costs will actually go down. Now, this should make intuitive sense to everyone that if a patient gets good quality care, that overall it would prevent worse outcomes later, so it would make things cheaper.
Ensuring all patients have access to a medical home will require physician payment reform that encourages and rewards high-quality, comprehensive, and continuous care.
As physicians, we only have two ways to earn our livings. It's with our time and with our skill. And we need to develop new skills as we integrate technology into medical homes, and we need to spend the time to do that. Our struggle, day in, day out, is with covering the costs of doing that. So we're looking to purchasers of care who realize value to help enhance payments to medical care, to patient-centered medical homes, so that we can provide a higher quality of service than we are already doing.
Your Academy is working with WAFP and other physician organizations, as well as consumer groups and large employers, to make the patient-centered medical home the foundation of our healthcare system.
When you consider the growing cost of medical care across America, there are certain common sense approaches that we should be turning to. Medical homes would be one of those, to make sure that primary care physicians can be in direct touch with families on a regular basis to provide them the best and most economical health care.
For more on what your Academy is doing for you, and to learn how you can get involved in the fight for family medicine, log on to the Academy website at www.wafp.net. For the Washington Academy of Family Physicians, I'm Jonathan Nelson, and this has been your Academy in action.